So the next presenting author will be Dr. Rohit Kumar Kompally, who will be presenting on a case series of OSSN treatment with only topical chemotherapy.
Good morning everyone. Today my topic of presentation is on case series of ocular surface squamous neoplasia treatment with only topical chemotherapy. So this is the outline. Coming to the introduction, as we all know, the conjunctival and corneal dysplasia along with squamous cell carcinoma constitute the spectrum of ocular surface squamous neoplasia and invasive ocular surface squamous neoplasia. For all these, previously surgical excision was found to be the gold standard, but it has high recurrences chances. So from the last 10 years, there has been a shift from the surgical to topical chemotherapy alone or as an adjuvant therapy along with the surgery. So coming to the risk factors, of all the risk factors, older age and male gender was found to have the strongest association along with other history of OSSN, ultraviolet exposure and prior skin cancer. So the aim of the study is to determine the effectiveness of topical 5-fluorouracil 1% as a primary treatment of ocular surface squamous neoplasia. So patient and methods. This is a clinical study that is conducted in Kamlani Institute of Medical Sciences, Narkatpalli, over a period of 8 months with 10 patients as a whole, age ranging from 30 to 80 years. So all the patients with ocular surface squamous neoplasia with tumor size of less than 4 millimeters were included, and the patients with tumor size greater than 4 millimeters or patients having recurrent lesions were excluded. So these patients were clinically diagnosed and monitored by slit lamp examination along with the anterior segment optical coherence tomography. So all these patients were treated according to Mudduveerappa et al. Study constituting topical chemotherapy 5-fluorouracil 1% topically 4 times per day for 1 week, followed by a drug holiday of 3 weeks. This constitutes 1 cycle. So the treatment continued till there was complete resolution confirmed, which is clinically with anterior segment optical coherence tomography. The incidence of various side effects were also monitored and the patients were followed up for a period of 3 months. So this is a case 1 which is showing the presence of elevated lesion present over the nasal side of the limbus, and the OCT which is corresponding with the mass which is showing hyperreflective mass present, which with demarcation of normal and abnormal epithelium seen. So after the cycles, which were 3, the patient completely had a resolution of the mass and the OCT was found to be normal. This is the second case, with the initial picture showing before the administration of topical chemotherapy, and the second one is during the cycle, and the last one is after the completion of 3 cycles, and the corresponding anterior segment images can be seen, OCT. And this is the third case where we can see the presence of leukoplakic type of OSSN present to the nasal side of the limbus, and on corresponding AS-OCT we can see the mass present, and post cycle there is resolution of the mass present. This is also another case. So coming to the results, in a patient total number of 10 patients, the median age was found to be 54.8 years. And coming to the gender, the males are most common people with and the prediction of 80%, and most of the all of the cases were unilateral in case. And vision, which is in most than 77% of patients have more than 6/60 vision, and only 3 patients have less than 6/60, which as the OSSN does not cause any hindrance to the vision was found to be normal, and these patients have some other related factors like senile cataracts, so the vision was less than 6/60. So coming to the risk factors, the excessive sun exposure, which was found to be the most associated along with old age among the risk factors, and so other associated are immunocompromised states like HIV, associated infections, and smoking, and prior skin lesions were also have in one patient. And coming to the symptoms, the patients have for foreign body sensation in 43%, and other patients have watering and chronic redness. So coming to the side effects of 5-fluorouracil, conjunctival hyperemia was found to be the most common side effect, which was found in 30% of patients. And other side effects are irritation, photosensitivity, and watering. And superficial punctate keratopathy was found in only 1 patient. So these are the other studies which shows Rafael Paparozzi et al., which has 45 patients, and the drug delivery was topical, and median number of cycles were 1 cycle, and recurrence rates were found to be 7.3%, and the side effects was as same as our study as conjunctival hyperemia. The other is Nandini Venkateshwaran et al., which has 25 patients and topical dose of drug delivery, and the median cycles were 2.4 cycles, and the recurrence rate were 3.3% according to that study, and the photosensitivity was the most common side effect. And Madhura G et al. With 13 patients, and median number of cycles were 2 cycles, the recurrence rate was 2.5%, and conjunctival hyperemia was a common side effect. In Mudduvirappa et al., the topical therapy was given and median cycles were 3 in number, and recurrence rate was found to be 0 as an R study, and conjunctival hyperemia and photosensitivity were common side effects associated. So coming to the discussion, as we all know, OSSN range from simple dysplasia to invasive squamous cell carcinoma involving the cornea, conjunctiva and the limbus. Clinical appearance is very typical, and OCT showing hyperreflective thickened epithelium with an abrupt transition between the normal and cancerous epithelium. Surgical excision with no-touch technique and base cryotherapy has the disadvantages of iatrogenic limbal stem cell deficiency and high chances of recurrences. Hence, the topical chemotherapy was used as a sole therapy in our study. 5-fluorouracil spreads all over the ocular surface, kills the neoplastic cells which are invisible to the naked eye. So, the 5-fluorouracil is a structural analog of thymidine which inhibits the DNA formation by blocking the enzyme thymidylate synthase. So these tumor cells which are rapidly multiplying require more amount of DNA than normal cells, and these take up the amounts of 5-fluorouracil, allowing the selective targeting destruction of cancerous cells. The advantages include shorter duration of treatment, no refrigeration required, and remains stable at 25 degrees, and it is very less expensive, and the patients prefer taking the 1 week per month treatment rather than daily administration. All the tumor resolved completely after the mean of 3 monthly cycles, and no recurrences were noted in our study. Conclusion: in our study, topical 5-fluorouracil as a sole therapy was found to be safe and effective modality for patients having OSSN and wanting medical management, avoiding the risk of repeated surgical intervention. The limitations include a small sample size, and in advanced cases of OSSN, topical chemotherapy alone would only help in chemo reduction but not suffuse the whole treatment. Also, the shorter duration of follow-up. These are my references. Thank you.
What are the other drugs that can be used?
The other drugs which are useful are mitomycin, ma'am, and interferon, ma'am, which are commonly used. But they must be used for daily administration. It is little expensive compared to the 5-fluorouracil, ma'am. So, and also the amount of administration is relatively less compared to other 5-fluorouracil and other drugs, ma'am. They need to be administered daily. This is only for 1 week, ma'am. And
what is the type of your study?
It is a clinical study, retrospective. It is a prospective type of clinical study.
Anything else? Was it observational or interventional?
Interventional.
Yeah, that should be mentioned in your type of study. And clinically, is there any staining procedure which can help you delineate the extent of the lesion?
Yes, ma'am.
Which stain do you use? Which type of OSSN responded better with your medical management? Was there any classification on that?
Yes, ma'am. Leukoplekic variety was most commonly observed in our study, ma'am.
Okay.
This was commonly treated.
Till what size was the OSSN responding to medical therapy, and after that?
Up to a size of 3 mm, it was found to be responsive, ma'am. Greater than 3 mm, it required both surgical and other medical management along with 5-fluorouracil.
Should have been there on your study.
Yes, ma'am. Thank you.